Hello, this is Dr. Tony Naldo here. We're talking today regarding our cool down phase, passive molding, pelvic rotation blocking. Now, this type of blocking is very effective in reducing pelvic rotation. It's a type of blocking that's been used for a long time in chiropractic and other techniques, and we just adapted it into our process because I believe it's extremely effective in helping derotate the pelvis. So let's go look why it's indicated. The most common reason why you would indicate pelvic rotation blocking is obviously you're finding rotation on an x-ray. So here you can actually see rotation on both these films. On this first x-ray here on the left, you can see this person here has posterior right rotation because you can see the angle here, the inferior sacral base is on the right side. So it has right posterior, left anterior. Here on the x-ray on the right, you can see the opposite. This one has right anterior rotation and has left posterior rotation. So you can see how both those pelvic rotations here on these two films. Now let's talk about how we want to set up our blocks. So we want to set up a block. The patient is going to be laying face up on the block. So the cervical roll here, if you see this roll, is used for their cervical spine. They'll use the appropriate roll that you have fitted for them, either the medium or the firm, or even the small roll if that's appropriate. A posterior left rotation means that the left block will be high under the left hip, pushing it anterior, and then the right block will be low, allowing room for the right hip to go down. So you can actually derotate the spine, and they're kind of pointing to each other like that. Posterior rotation on the right is going to be set up just like this. This person has the block is under the right side high, left side low. The right block, we push the right hip anterior, and we have room over here for the left hip to go down. Again, the patient's on the cervical roll. Here you can see a patient laying on the table using the cervical roll set up for a right posterior rotation using the blocks to derotate the pelvis. So let's talk about the steps. So the indication is obviously to reduce pelvic rotation. Instructions are done for a 20-minute time period, and it's a cool down period. We're trying to cool down the spine and cause creep into the spine that cause derotation. The repetition is once per day. This can be done after any activity for 5 to 10 minutes. So if they go running or jogging, they do any kind of activity, exercise, max T3, they can lay down on their rolls. The reason why, because when you warm up your tissues, they're most susceptible to creep right when they're warmed up. So if you do the cool down phase after any kind of activity that's going to warm up their tissues, it can have a great effect. So let's go ahead and watch this video on how we actually set up these blocks, and I'll be back with you in a minute.
Hello, this is Dr. Tony Naldo talking to you regarding your blocking package or your home care blocking system. Today we'll be talking about pelvic rotation. Now, pelvic rotation is a very common subluxation pattern we unfortunately see with patients, so we have a blocking system to help reduce that subluxation pattern. The way you do this is you can use your appropriate cervical roll. This one I'm showing the medium roll, but of course you can use the one that's set up for you, whether it be the firm or the small, whichever one you're using. Then you're going to use both wedges, and both wedges, you're going to be positioned off center like this, kind of with the thin parts pointing toward the center of your body and the thick parts pointing toward the outside of your body, kind of either in this position or kind of like in this position, depending upon how your rotation is. So we go ahead and set up here how we set that up. So this is go ahead and lay down. We're going to have her lay down on her cervical roll, and then the idea is that we're going to have these blocks put in, and we're going to go ahead and lift this hip up first, and it's going to go under here and that, and then this one's going to come over here. Okay, and they're kind of like in like this to help reduce the pelvic rotation. What it's doing is going to lift this hip up, and it's leaving space for this hip to go down. So it's creating this torquing of the pelvis. And the idea is that depending on which side you have the blocks on, will depend on which ones you'd be rotating, which one you're rotating forward, which one you're rotating backwards. So we go ahead and lift your hips out. So the blocks are kind of set up like that on her. So this is just under her pelvis, and this one's more under kind of her upper thigh going in like that. If I was going to set up the opposite position, it would be like this. Okay, so we go ahead and show you. Go here, this one goes under there, this one comes over here, and that would be the opposite pelvic rotation. Now again, this is a position that you wouldn't sleep on. It's a position that you do for 20 to 30 minutes, once or twice per day, depending on how your doctor prescribes it. Some people go longer, some people go shorter. Just make sure that you follow your doctor's prescription. Now, sometimes you can also use this with your lumbar roll. You can possibly have your smaller roll kind of positioned right here, but in most cases, this is the way it's done, just like this.
So I hope you enjoyed that video. Now let's talk about pelvic rotation that you can possibly use in your office. Now, you can do this as a pre-block while the patient's waiting to be adjusted by the doctor. When they walk into your room, they can lay face down and they can pre-block themselves, or face up and pre-block themselves. You just got to teach them how to place the blocks appropriately. And I always tell patients that if they're pre-blocked, they're getting a slight stretch before they get adjusted, and it actually can assist. Remember, the more they're on these blocks, the greater effect the creep's going to have. So I hope you enjoyed this video on how to use pelvic rotation for home care and office care. If you use this blocking system appropriately, you're going to see great reduction in those A to P lumbopelvic x-rays.